Broadcast is now starting. All attendees are in listen-only mode.
Okay, there we go. Sorry about that. I had to show my screen. So, uh, we do have a full house today, which means I'm going to keep everybody muted. If you have any questions, there is a questions chat box down in the bottom right. You should be able to see it, or it's somewhere on your screen where you can ask questions. Taylor McDonald with CSG is here today. She is going to be going over this tool with us more in depth because she actually works there where I just advertise it. This tool is a quoting and enrolling software. I've talked about this with everybody. I see a lot of familiar names on here, so everybody, I know you've heard me talk. It's all about streamlining the Medicare business, right? We talked about selling Medicare's quantity. It's a quantity game. Medicare is a great foot in the door to cross over to the other products. A lot of the agents I see on here are my annuity advisors. Medicare supplements especially, which is what this tool is really streamlined for, and Taylor's going to go more in depth with some of the other products, but on the Medicare supplement side, Medicare supplements are a phenomenal foot in the door to cross-sell over to the annuity advisors. Myself personally, that's what I do. There's a lot of people, Medicare, when someone's talking to you about their Medicare, especially turning 65, they're retiring, right? They're rolling off their group coverage. Their immediate need is to get their health insurance covered because their health insurance that they had before now isn't going away. Their immediate need that they need to take care of is their health insurance. They need to get their Medicare insurance in line. So an agent like yourself, when you get in the door, it's a phenomenal foot in the door to then cross over to things like their 401k rollovers and things of that nature on the annuity side. So, like I said, today we're going to go over this with Taylor McDonald. This tool is free of charge through Insurance Agency Marketing. Next week or the week after, I'm still trying to get it lined up. We went over last week the Connect for Medicare tool. This week we're going over the CSG tool. Next week I'm going to go over the marketing services that IAMS offers our agents. I know a lot of agents on here. You're having Jacob and Sean in our office take care of your website designs, things like that. So again, I'm going to kick this off to Taylor. We'll answer any questions as we go. And Taylor, I'm going to pass this off to you.
Thank you so much, Alex. Hi, everyone, and thank you for joining today. I'm going to be walking you through a few different pieces of the software. So I'm going to show my screen here. I click show my screen. Can everyone see that, Alex?
I can see it on my end, so I'm going to assume yes.
Okay, perfect. So this is the IAMS quoting tool that you're looking at, the CSG version of the IAMS tool. So I'm first going to walk you through the Medicare supplement quoting tool. Everything that we're going to do here on CSG can be accessed from this dashboard here. So when you first log in, this is what you're going to see. And to start a Medicare supplement quote, we'll start by just clicking Run Quote. And then you'll go ahead and enter the zip code, the age, gender, and tobacco status of the person you're running the quote for, as well as the plan type you'd like to quote. So we do have the high deductible G and high deductible F in there as well. Today we'll just run a regular plan G. We can choose how we'd like to sort these results by, so by price, cheapest to most expensive. We can also sort by AM Best rating or S&P rating, or by company name alphabetically. So most of the time people will select the price here to sort by, and then we can also choose the effective date. So we'll leave this as 10/18 today, today's date, but if we were going to maybe wait until after the 1st of November, we can move this out to see any future rates that are going into effect. And we can actually anticipate those rates and see any future rate changes that will be occurring. We can also choose whether or not we'd like the household discount applied. We'll leave this as not applied for now. And once everything's entered, we can also choose a client label. So we'll just say IAMS client. I can type it. So this is just our name. If you were to do a printout, this would come up on the printout, and it keeps it nice and organized for you, knowing who you're reading the quote for. So we'll go ahead and hit Get Quote. And we are going to see that for Medicare Supplement, as well as Medicare Advantage, we do have 100% of the market. So it's literally every plan for every carrier across the entire country. So we're not missing out. You don't have to worry. You know, if you are what you're missing out on here, you're going to be able to see everything through IAMS. So we will see here the cheapest plan is $95.58. We are seeing that they have a household discount of 7%, a policy fee of $25. Who the parent company is, as well as the AM Best rating, the rate type, the plan type we ran the quote for. We can also open this up by clicking Market Analytics, and we're going to see this drop down that shows us the age increases increase history, and market data for this carrier, this plan. So the age increases are telling us we ran a quote for a 65-year-old, but if this person were to turn 66, does the rate go up? It looks like it stays the same. So next year they wouldn't see any increase. 67 is not going up either. 68 not going up yet. But at 69 we can see if everything else stayed the same, it would start to increase. So a lot of these plans might jump up faster. Some of these they won't increase at all in the next couple of years. That's just showing a projection based on today's data and today's numbers. The increase history is going to show us the last increases or decreases that this plan saw. So each time the rate change, a lot of these looks like they haven't changed a lot here. But we can see for Philadelphia American, they actually had an increase back in 2016, but then in 2017 it dropped down. So it's just a good tool to see how these rates are behaving year over year and how the increase or decrease history has behaved. The market data is going to show us both on a national and the state level, the lives, the premium amount, the loss ratio, and market percentage. If we ever want a little bit more information on any of these numbers and definitions of those, we can go down here to About Quote and click this About Quote button, and it's going to give us the definitions of the age increases, increase history, covered lives, market percentage, premium, and loss ratio. So if you're ever going through this with a client and they say, what does that even mean? What's this market data? It can actually give you definitions here and where these numbers are sourced from. So that's also a great little tool down here to click on.
Hey, Taylor, can I jump in here real quick?
Absolutely.
Okay, so we had a couple questions come through here. One, where is this on the IAMS site? So if you go underneath the IAMSinc.com website and go underneath Senior Health Products and scroll down, I believe it's like towards the middle of the page, you'll see my mug face on there, and then you scroll down and there should be Connect for Medicare and then CSG. That's where you're going to find this tool. You can, again, also give me a call after this webinar today, and I can walk you through it. We'll give you anybody that is contracted with us has access to this free of charge. So one of the questions also on here is, does this affect our commissions? No. This has nothing to do with your commissions. You are still paid everything that you should have. You are paid direct through the carrier with us. So this does not interrupt anything of like that. We are taking care of this for you free of charge. This does not affect your commissions. You can find it on the Senior Health page, and also give me a call and I'll help you get lined up. Taylor, I'll let you back at it.
Thank you, Alex, for explaining that. So I'll move on to the compare quote feature. So if we have a couple of carriers that somebody is really interested in, a couple plans, you can actually select up to 5 at a time to compare, to make it a little less cloudy, a little more concise for your client. So if we click on each of these, you can notice they turn green. And again, we can select up to 5 of them. I'll select just 3 for now. And as we selected each of these, they populate under this compare quote section. And then if we click compare quotes, it's going to show us a side-by-side comparison of all 3 of these plans. So then we could do a PDF export. We could print this out for them. And it's saying it's for this IAMS client. And we can do up to 5 at a time. So it makes it more concise. We can still see these company details, but then we can really compare them side by side and make it a little bit more concise. If we want to remove these out, we'll just click these X's and they'll be removed. We can also click apply discounts, and this would show us with the household discount what the rate would be. So if we click that, we can see it automatically changes. We can see what the annual rate would be if they're to pay annually. And we can also choose whether we'd like to include any select plans in our data as well. Okay, so that's a good overview of the tool in a nutshell for MedSup. We'll take us back to the dashboard here. Did anyone have any questions about the quoting tool for MedSup? Do we see any questions come through, Alex? Any additional questions?
Someone is actually typing as we speak, so give it 1 second.
Okay, no problem.
Yes, so the question was, Alex, is this what you were talking about when you said you could sell over the phone? Yes, this tool right here lets you sell over the phone. So something that's kind of nice to do is if you look over on Taylor's screen here, underneath where it says in the top left where it says IAMS, you see our logo. Beneath it, it says export. Okay, if you look at the export tab, first off, you can print. There's the print tab. That's pretty self-explanatory. Prints off what we're looking at here. Prints off the quote screen that we're looking at here. If for some reason you need to print that off with your client when you're with them. But here's the thing I really, really like, okay? The PDF version, okay? You take the PDF, You take that PDF and you could put it in. So if you're selling over the phone, right? And a lot of my agents, like you guys that are selling over the phone, and I know someone was talking to me about this, Elliot, I see you on here. This is where you can get on there and exactly. Thank you, Taylor. This is exactly what pulls up on the PDF. You can attach the PDF as you download it. You can attach it to their email. One of the things, Taylor, could you go back over to the plan details for me real quick? Okay,
Yep.
plan details. So you have that printed out screen, right? You have that quote sheet. Here's what Part A and Part B do. This just shows you what, so it shows you what Medicare pays. That's the Social Security. This plan, that shows you what Aetna Health and Life's Plan G pays for, right? That's what this plan is saying. Then it says you pay. That is the remaining out-of-pocket expenses that the client is responsible for. You can, if you see the view printable, you can also print it to PDF, download as a PDF, and you can do that with both your Part A and Part B. You can take all three of these things. Take your Part A, take your Part B, or I'm sorry, it shows you on one screen. So even that's better. You take this, okay, you put it on the email, you send the quote sheet with that exact same thing. So when you're selling over the phone, you explain to the client, this is what Part A is covering. This is what your Part B is covering. Today, what I'm showing you, the quote sheet here, all of those carriers are going to cover the difference of what those parts do not cover. Okay? So when you're showing them this, this is how you can effectively sell over the phone. Now, Taylor, did you go over the electronic app yet?
Not yet. We haven't quite gotten to that.
Okay, she's going to show you. So when you're showing your clients these three things, okay, Part A, Part B, here's a quote. Next is the e-app enrolling. So she's going to go over that as well. But yes, this is exactly what I was talking about when I said you can effectively sell over the phone. And this is used by many agents. I know the majority I've talked to. I come from a different background. I've worked in the FMO system for a long time. The last brokerage I worked with, 80% of their business was Medicare. Okay. A lot of my agents sold over the phone. Selling over the phone is very, very popular. Okay. Especially if you have non-resident license. I think we can all agree the amount of travel time you're saving, the amount of time you're saving, window time you're saving, this tool will do all of that for you. And Taylor, I'll let you take it.
Thank you, Alex, for hitting on those pieces too. It's always a good reminder of how you can see those Part A and Part B effective, or Part A and Part B not effective dates. We'll get into that in a minute. Okay, so another piece, let's see. Let's take us back here to the dashboard. So this is the Medicare supplement quoting tool. I'm going to now show you, before we get into the ESOA, we'll get into the actual e-application. So how you would actually submit the application for Medicare supplement. So how you would start a new one is just as we did. I guess I could have stayed in there, but you would just start by running the Medicare supplement quote. We'll hit get quote because we just saw how to do this. And then for any of the carriers that you'd be able to submit an e-application for on CSG's website, so you're not having to leave, go to the carrier's website. It's literally done on this platform in the software. It's going to have an apply now button. So if we scroll down, we can see that Aetna has one here. So we would just hit this apply now button. Another piece I want to touch on too is the carrier resources. We just added this. It's a brand new. It will actually take you right to the website if you need to look up anything on the website. And we also have these for almost every single carrier. So if you ever need to go to the website, you can, but why leave when you can just submit it right here by using this apply now button? So we'd click this apply now button. The first time you're submitting an application in a particular state for a particular carrier, you will have to enter in either your producer number or your writing number. So this is where you'd enter this. I'm not going to actually do it on the IAMS portal because I don't want to actually submit a fake app right now. So I'm going to take us into a little demo account that we have here. It's just called Your Logo. And it's going to look exactly the same as it would if you're doing it on IAMS, but I don't want to actually submit an app. So after we click this apply now button, it would take you in. I'm going to open up one that was already started, so we're not actually filling out an entire app here while we're on the phone. But you would just, I'm going to switch this over because it kicked me out. You would just switch over to underneath e-applications, view active. This would show any that have been started or already submitted. So that's where we just were. I'm going to take us back there. And we're going to go into view active, as I just said. So if you already had started an app, this is how you would find it. Wait for this guy to load. Okay, I'm going to take us into this one we've already started. You can see I created it earlier today. This is our full underwriting test. So in order to start this again, I'd click Edit, and we'll hop right back into it. So that's the other nice thing. You can always start it, and if you don't finish it right then and there, you can always come back to it. It's going to save it for you, so you can always come back and finish it later. So after we had already entered our producer number, this is where we would start. It's going to show us the applicant information, explain how we heard about this, ask the client how they heard about us, the plan type. If we ran a quote initially for a plan G, and then let's say we switch to a plan F, if we switch the plan, it's going to automatically update the price. So you never have to worry if you start the application, they change their mind what plan they want to sign up for or apply for. You can switch that, and the system's going to automatically update. So everything's going to be updated in real time. The same thing goes for any underwriting information. So any drugs that they're taking or any health conditions that may possibly decline them, it's going to tell us right away, so we're not wasting time submitting these apps when it could be a potentially declinable condition or declinable medication. It's going to tell us that. So I'll show us an example once this gets done loading for us. So we'd enter their first and last name, the requested effective date, their address, their height and weight, tobacco questions, everything a normal application would ask. Every carrier rule that they have, so carriers are obviously going to be different for different questions they ask. That's all going to be reflected. It's universal in the sense that it's going to be the same process for the carriers we have here, and we're going to be going live with a lot more carriers this coming year in 2020. It's going to ask us about the household discount, so we'll say no for now, but you can always add in yes and put in the person's name so we can get that household discount applied, make it even cheaper for the person. It's going to ask about their Medicare information, so it's going to ask about all their Medicare Part A effective dates, Medicare Part B effective dates, if we're applying during open enrollment. So it's going to catch this. If they turn 65 in the past 6 months, it's not going to make them go through all this underwriting information. It's going to recognize that this is open enrollment, and they don't need to go through all those questions. So of course we hit no. We're going to pretend that this person needs to go through all this underwriting, just so I can show you guys how that would underwrite in real time. This is our previous or existing coverage information. So it's going to ask if we're currently covered under any of these other Medicare programs, any other health insurances. We'll say no for these. And then for the health information, it's going to tell us up front, if yes is answered to any of the following questions, the person is not eligible for coverage. So if I select yes, you can see right now everything's green, we're good. If I select yes for any of these questions here, you can see the app is updating, it's underwriting in real time, it's recognizing that I selected yes. And we're actually going to get a notification telling us that this applicant may not be issued coverage because we answered yes to at least one health question. So of course, this is for Mutual of Omaha. I know for Aetna, if you do this, it won't even let you submit the app. So this one, it's going to tell you they're going to be declined, but it will still let you submit. For Aetna, they don't even want you to submit the app. It won't even submit if you have answered yes to any of these questions. So really nice that it underwrites in real time. It's going to stop you and let you know. Of course, if they really did have any of these health conditions, you wouldn't want to remove it, but I'm just going to remove it so we can get through the app and I can actually submit it. The next section is going to be the medication information. This is a really good one, again, to have underwrite in real time. So if we select yes that we're currently taking any drugs, we can look up any drug pretty much out there. Any prescription drugs. Takes a second to load here. This one is usually a declinable one. But it's going to come up with pretty much any drug you can think of for, here we go, any over-the-counter drug, any prescription drugs. You can select the dosage if it's necessary, the frequency, maybe we take it twice a day. We can say how long we've been taking this, and then we'll say that we're taking this for kidney. Once we've entered that drug, we want to make sure we hit add prescription. It's going to add it here under entry, so we can add multiple drugs if they're taking multiple prescriptions. And then when we hit continue, we will see again that it's going to underwrite in real time We're going to get a message about this drug because it is a declinable drug. So again, we get this pop-up here. It's saying this applicant is unlikely to be issued coverage because we've included a possible declinable medication. So again, if we really wanted to submit this, I can leave it in there for now because it will still submit with mutual. But it's going to tell us this notification, so we're not going to be surprised at the end if we entered something that maybe would decline them. We are to the spot now, method of payment. So we can actually choose if you for some reason wanted to print this, you just wanted to use it as a PDF filler, you technically could do that. You could select yes and print this and get a wet signature and mail this in. We can choose how we'd like to pay for this. If we want to pay by check, we can pay by automatic bank withdraw, direct bill, or automatic bank withdraw. When we'd like to be billed, we can choose the 1st or the 15th of the month, as well as what account we want to pay from. Pretty normal here, just their billing information, and then we'll hit continue once we've filled out all their billing information. We can choose where we'd like to deliver the policy to. We state that we've recorded all this information accurately and that we interviewed the proposed applicant. We can also add in any notes to underwriting and upload any file. So if we have a notice of termination or an evidence of insurance, we can upload all these files as well, so they'll be submitted with the app directly to the carrier. Once we have these green check marks all the way down, we can see that everything's filled out. We didn't miss a step. We'll click Verify Application. So you know as you're going through what your progress is, how far along you are in the app by looking over here under these sections and seeing where it's green. It'd be a yellow exclamation point if we still need to go back and submit some information. So we're going to verify this information one last time, make sure every section is complete. If we see anything we need to change, we can just edit that section, go right back in. But everything looks great, so I'm going to go ahead and lock and e-sign. Again, it's going to remind us that we did have a drug in there that's probably going to decline us, but it's still going to let us submit. We're going to agree to these terms and conditions after reading them. And once we submit this, so we're going to say that we are in the same physical location, because if we are in the same physical location, pretending my person is here, the applicant can just provide identifying information, meaning the mother's maiden name and the last four of their SOCH, and we can send it in. If they're not with us, we're over the phone, as Alex was mentioning, we can actually email a signature link to them and they can sign it via email, so they don't have to be with us in the same physical location. So we do have to open each of these, so I'm going to click on all these. So we know that we read these. We're going to say that we've read, opened, and kept a copy. We'll say our mother's maiden name, last four of the SOCH, where we're signing, apply the e-signature, and then the producer will apply their e-signature as well. Now we're going to go ahead and sign this application. So it's going to be submitted. We will actually get a policy number right away. So it's not going to tell us the status of the actual, whether or not the application was actually approved or declined, but we do get a policy number so we can follow up with the carrier to see whether or not this was approved or declined. But you're going to get a policy number right away here. Just takes a minute to load. And we have another chance here to go back in and get the terms and disclosures, outlines of coverage, the application itself, which fills itself out as a PDF. I can show that to you here while this is loading. So you can keep all these files. It's going to keep all of them for you in the system, keeps it really organized. So here's this PDF. So we can reference this. All the information we entered is there. And we have all these documents to save. Still submitting here. Okay, so it gave us this green check mark, the portal, which we are currently logged into. It's obviously a testing account, but we would get a policy number submitted right here, and this is where you would have it. And if you go back to that dashboard, it will actually keep that policy number there for you in your submitted applications.
Hey, Taylor, we just had a question if we could get a voice signature.
Great question. So for Aetna, we do have a voice signature. They are currently revamping it right now. And so they are going through some changes with Aetna right now with that voice signature. But previously we did have the voice signature for Aetna. So that is a capability that we have. So as long as it's accepted by the carrier, we will also allow that voice signature. It's just that right now Aetna is currently reworking how they're doing those voice signatures, but we did have it before they started reworking some of that. So if it is available, we will have that option available.
And no, Taylor does not work in this office. I know someone, couple people have asked that. No, she does not. Taylor is actually a rep of ours down at CSG Actuarial. She actually came in the office last week with her partner. They are planning on doing some more stuff with us. Some of the things that we are going to be doing will be on site at IAMS. I am planning on doing some sort of training at some point in time. We will most likely have them there at that point in time. We are going to have a local presence as well as our national. So, but no, Taylor does not work with IAMS. She is over at CSG.
That would be fun though. Okay, so the last piece, if we don't have any other questions on the EAP, I'm going to hop over to our ESOA, our new electronic scope of appointment document signing, and show you how this would work. So we just launched this year. It's brand new. If we go into this ESOA here, and we can do it with IAMS as well, but I'm going to do it on my account, here, my private account. If I click View List, it's going to kick me out. We can actually do an electronic scope of appointment for Medicare Advantage. So obviously AAP is a crazy time with that. You'll now have access to be able to send out scope of appointment forms electronically and get them signed electronically, and also store these documents within the tool. So here we are in the document locker. If we wanted to create a new document, we'd click this blue button, but any documents we'd already sent out, any scope of appointments that we want to store, they'd be here in this locker. So if I click create, we can see that I have some incomplete ones here that I've started for some fake people that I've been pretending I was doing scopes for. And it would actually, it says awaiting email signature, awaiting signature type. So these are all any that I've started, but the ones that are completed would be on that first screen I just showed you. So we'll quickly walk through how this would work. It's really easy. It's nice to be able to keep them all in one place. We'll say IAMS, save and continue. So we're just naming this document. Agree to the terms and conditions after reading those. We'll click continue. And this does have that email signature link as well. If they're with us, let's say yes. We'll say that they just provide the identifying information like we did for the EAP, mother's maiden name, last for the SOCH. If they're not with us, we can only do the email signature link, and then we put in their email right here. So I'm just going to put my email here. We'll hit continue. And then what they'll receive, I did one before we started here. It's going to tell us we're waiting for this applicant email signature, but I actually did one beforehand. So this is the email they would receive. It's really concise. It says CSG doc signature verification. Your verification code is 148436. That's our number. And then we would actually click here, and it's going to let us enter it right away. So we can actually even copy this in if we wanted. Boom, it's signed. So again, we can agree to the terms and conditions, but it's really easy to get a signature. And then this would be me, the applicant, filling out this scope of appointment. So I'd go through each of these steps. I'd sign and complete, and then it's going to be populated. If I come back here,
Taylor, we just got asked if a customer can watch the process on their computer.
If they can watch the process?
Yep, like a screen share.
You mean like in place of them being like present with the person?
Yeah. So, I think I know what you're talking about. So, Mike, I believe you're asking if basically if say you're in Nebraska where Taylor and I are at, and your client's in Georgia, while you're filling out the application, can they see the screen at the same time you are? No, I do not believe CSG. Taylor, correct me if I'm wrong. I do not believe they have that process, but I do know of some free, very click of two buttons softwares that you can use on your computer for free if you want to do that with your client, where you can screen share with them at the same time.
Yeah, CSG doesn't have the screen share capabilities built in, like their own screen share software, but whether or not you could show that, I'm not sure if there would be some HIPAA rules there with like showing them. I don't think it would be. If it's all their own information, you should be fine. But if they're not with you physically, they should do the email signature link versus just providing the identifying information. That's what you should do. Okay, so they would go ahead and they'd fill out the scope of appointment. I'm going to bring us back to my going to go back to documents here. So they would, of course, fill this out. Alex, would you like me to fill this out so you can see what it looks like submitted, or do we want to go ahead and just show them where it would populate back again?
Whatever
Actually, I'm
you
not
think's
sure how we're
best.
doing. Okay, we can go ahead and show them. These are old forms from the EAP. Okay, so if we went ahead and fill this out, we'll say we talked about these things, applicant's name, test. We'll say friends. Okay, city, test, 11111, apply, sign and complete. Okay, so then once the signature has been received, it will be in our document locker here. We'll find this. Let's refresh it. Should be showing here. Might take a second for this to populate since we just did it, but we went through the whole process. It would be populated here under my locker, and so this is where it would populate. We just did it, so it might just take a second here for it to load, but that's where it would populate, and that's where we would see the file name, and I named it the IAMS. It would show that it's the ESOA, but we can also export this. So if for some reason we ever need to do a mass export, let's say you have hundreds of SOAs in here, you can export the entire document locker, or you can always upload any existing SOAs. So if you already have a stack of paper SOAs, you want to scan those in, you can upload those so they'll all be here together in your document locker. So it can be used for more than just SOAs. Any questions on that coming in?
And we do have a question here. Yes, we do have that Connect for Medicare. That unfortunately is not CSG, but I do know, Taylor, if you want to touch on it, that you guys are planning on rolling out an electronic platform for Medicare Advantages. If you want to touch on that real quick.
Yes, so for AEP this year, of course it's AEP right now, so we did get this electronic scope of appointment live for AEP right now. That's kind of the first step towards our Medicare Advantage enrollment platform. So in 2020, this coming year, we will be rolling out a Medicare Advantage e-application process. So we will have both the Medicare Supplement e-app, as I just walked you through, and we will have these capabilities available for Medicare Advantage as well. So you'd be able to do MedSup, Med Advantage, all in one place, both applications, and have your ESOAs all in one place. So this is a first little step that we're making. We got this live again in time for AEP, so people could start using it this year, but next year we will be rolling out the Medicare Advantage e-application as well. So pretty excited about that.
So I do have a question. There's a question also that came up on here. Taylor, I'm going to need you to answer this too. I know some carriers are doing it, but I don't know how many are. Yes, there are a few carriers that are rolling out that after you submit these e-apps, they are able to kick back to you within a certain period, with just a short period, if the application's been approved or not. Taylor, could you touch on that?
For the e-application?
Yes.
So we wouldn't show any of the approve or deny. We would kick back that policy number, but then any of the information about whether that policy was approved or denied, you would need to use that policy number to look that up. So we wouldn't be able to show approve or deny through our system, but you will have that policy number, and then you can go in and then check using the carrier's website, go in and check on that policy number, but it's not going to tell us right away if it's approved or denied.
And some of the carriers, and I can speak on that, so no, the actual CSG tool is not going to kick back and say approved or denied. But, and you guys have to remember, Taylor works with CSG. She does not work a lot with the carriers. But if you do go on to the carriers' portals through that carrier resources and pull up your list of applications, which we cannot show you on here, but I can show you offline here. There are, because these are being done electronically and they don't let you make mistakes, some of these carriers, National Guardian Life has actually nailed it down to 10 minutes. Some of these carriers are showing you approval or denial of the application within an hour. I would say at least tops right now is what they're looking at, within an hour of submission of the application. So now, again, that would not be showed through CSG. That would be showed electronically in your carrier's list. How do I want to explain this? I'm having a brain gap here. If you go to like Aetna, for example, okay, or I'm sorry, United Healthcare. Let's use that for example. If you go into Jarvis and look up all your clients, it'll tell you, like United Healthcare, I believe they're sitting at right about a half hour of approval or denial of the application. But again, that would not go through CSG. We have another one here. If we are not certified with all the carriers, available carriers. Yes, so CSG is simply just a quoting. Taylor, would you mind going over to the Medicare Advantage PDP tab?
So just a quoting tool piece?
Yes.
Okay, yeah.
And type in yours and my zip code if you wouldn't mind for me real quick.
Yeah, no problem. Okay, it keeps kicking me out again. I think it's a little confused since I'm acting like 5 people right now. All logged in at once.
And while
So
she's pulling this up, yep. So go to that, the Medicare Advantage PDP. Yep, run quote. Do our zip code for me if you real quick.
Any Omaha zip, or do you want to mind?
68135.
Okay. Go ahead and run the quote.
Yep. Okay, so and then will you uncheck expand quotes for me, please, real quick?
Mm-hmm.
So this will show you all the Medicare Advantage plans in our area right now that we're working with. So Aetna, Humana, United Healthcare has a strong presence in Omaha. So yes, to answer that question, CSG will quote it. The difference, and I believe if you were on last week's Connect for Medicare, the difference being is because Connect for Medicare allows you to enroll. Okay, that does allow you to enroll while you're comparing and listing drugs. This is not doing that. This is giving you a very high level overview of the carriers that are in our area and doesn't really break it down. Now, check if you could check mark expand quotes for me real quick.
Yep.
This will give you the highlight level of the plan, so you can tell here this Aetna, like this is what I write, this Aetna HMO plan or the PPO plan. Okay, and let's look at the PPO because that's one's a little bit more popular here. You will see it's zero money monthly with only a $4,500 max out of pocket, right? We all know on the Medicare Advantage, though, there's a lot more to it than just that. So, like I said, this will give you a broad overview of who's in the area, but this does not go as near as in depth yet like Connect for Medicare does. Like Taylor said, CSG is rolling out the Medicare Advantage enrollment tool side of this. That's exactly what she actually introduced to me last week when she was here in office when we were going to go over this quoting tool. So soon, I'm sure it'll be the exact same feature, but it's not right now. That's why I want to make sure we all very clear on. You can do the electronic scope of appointment. You can quote the area, but no, it does not let you go beyond that because it's not there yet. That technology is not there yet.
And I do want to add, Alex, for the Medicare Advantage, we did just release a carrier resource button for this as well. So when you click on this, it will link you to the carrier's website for physician lookup, pharmacy website, and the formulary website. Most of them we have all 3. Some we may just have 1 or 2. You can't enter them like the drugs. You can't enter them before you run the quote, but let's say you're set on Aetna, you can actually link right to the formulary website. So it makes it a little shortcut for you. These are available, but it's not going to actually let you enter the drugs before. But it is a little shortcut, so I wanted to point that out for the carrier resources button.
Thank you very much.
No problem.
Yes, I'm sure. We have a question here. Can we reach out to Taylor if we have questions regarding CSG? Taylor, I will let you speak for yourself.
Yes, you certainly can. If you have any technical questions, so how does something work, or you're asking how to use something, or you're having a question about getting logged in, you can certainly ask me those questions. A lot of those things, like getting approved for the software and those things, have to be handled through IAMS or through Alex. But if you ever have any technical questions about how the software works, or you're having a technical problem, something's not looking the way you think it should, you can certainly reach out to me or Alex. And Alex, they are welcome to reach out to me, but if you'd rather have them reach out to someone at IAMS, that's kind of up to you, but I am available as a resource as well.
All right, someone just asked here, and I'm going to try to go over this real quickly. Alex, why would I use this tool over what I'm currently doing? Give me a scenario where this is beneficial for me. Just asking for the simple purpose of marketing purposes. Okay, so let me kind of go over why I push this tool so heavily. Taylor, just let me go on for just a quick second.
Yeah, I will.
All right. So this tool, again, free of charge to you to work through us. Okay, electronically quotes and enrolls, as you can see here, does all the product lines. And as Taylor hit, it will do the Medicare Advantage side. Yes, we will provide this to you still free of charge when the Medicare Advantage side kicks on. Okay. With that being said, a lot of you I've talked about with our marketing team that we have underneath our roof, Jacob and Sean, that are here right now, where we do website development, marketing development, everything for you, right? Medicare is heavily going internet, okay? Internet, digital marketing, everything is, right? So a lot of you have talked about the digital leads that we're starting to do here. We're probably going to, IAMS is going to launch them. We're looking for a 1/1 launch date. Not going to hold, don't quote me on that. We are looking for a 1/1 launch date to where we're going to do Facebook driven leads, right? Everything's moving online. When we're running, let's say for the sake of argument, I'm going to give you a scenario, okay? Alex lives in Nebraska. He has a non-resident license in Colorado, Iowa, Kansas, California, New Jersey, right? When I have Jacob and Sean build me my website because I'm doing my products through IAMS, as I have them build my website, I'm also going to purchase leads in the states I don't necessarily live in. My Facebook ran leads, okay? When those leads come in, I'm in Nebraska. I'm obviously not going to fly out to New Jersey just for one client. What I'm going to do is I'm going to call them to help them save money, help them learn about their Medicare, whatever it may be, and use this program to effectively get the same meeting done that I would if I was in person over the phone. Now, some of you, I've also talked about this where some of your websites, we're going to try to plug in a calendar meeting. Okay, and what that is it's a calendar. You can get on there and mark off the days you do or do not want appointments and between what the hour frames you do or do not want to see clients. So Mrs. Jones can come to Alex's website. I want to talk, and Alex is Nebraska. She's in New Jersey. Ms. Jones can say, I want to talk to Alex at 2:30 on Wednesday about my Medicare plans. We can talk over the phone, effectively get this meeting done over the phone with this tool that CSG is letting us provide our agents. Okay. Now, this program I see here as a question as well is online. You do not have to download this. As I told you guys, when you go in, when you request access to it, and if you haven't yet, I'll go over it when you do request access, because as long as you're contracted, we give this to you free of charge. You go to our insurancetoolsportal.com/IAMS. You have to make sure you hit the /IAMS one, because that'll actually populate the one that we're paying for. Okay, this has our, as you can see here, has our color scheme: blue, red, white. IAMS is up in the top left corner. That's the one we're paying for you free of charge. If you just go to insurancetoolportals.com and try to log on, it's not going to let you in because that's not the subscription that we're paying for. So on the flip side of that, there is an app that you can use. So if you are doing this, I don't ever suggest doing an electronic application on your phone because it's just too much information on a little screen. But a tablet, I've talked to a lot of you about the tablets that we offer, especially for our annuity advisors underneath there that did our Quick Start program. You see that we offer free tablets for getting started with us and write just a little bit of business. Okay, you can actually go on there, and I believe if it hasn't been fixed yet, I'll get with Taylor and CSG after, but it's going to be IAMS quoting on either Apple or Samsung, whatever products. You can get on there and download the software, log in the exact same way, and use this tool the exact same way on a tablet. So like myself personally, I have a little laptop bag, I have a MacBook Air, I have an iPad Air, and I have my phone. Everything talks with one another. That's exactly what I use to write business. Okay, so this is a very streamlined tool for you to use. And this is where it's a plug and play for us on all different platforms of what we're doing here. And with that, Taylor, I'll let you go again.
Yeah, that pretty much covers everything I think that I was planning on hitting on. So if there's any other questions people have or anything else, Alex, you would like me to expand on, but I think pretty much I hit on everything I wanted to make sure I got to today.
Okay, we have another question coming through. Uh, okay, Taylor, what was asked is can we pull apps and brochures off of this to print off ourselves? Would you like to touch on that a little bit?
Yes, and we do have, and Alex, you and I can talk about this a little bit, maybe offline, but we do have a tool that does that. Whether or not that's something that you want to offer, it would have like brochures, outlines, sometimes like outlines of coverage and things. We can talk about that maybe after, but we do have some of those available that you can get from the tool. Not currently live on the system, but we can talk about getting that live if that's something agents are interested in.
Yeah, and I believe we did. Ours should be coming on the IAMS one. We did not have it turned on, but I did talk with someone else over at CSG. Yes, we are offering that. So Taylor is a little bit newer to working with IAMS on this. Like I said, I just met her last week, and she's helping us move forward with this. Yes, we will be offering the PDF version. You could download the app, print it off yourself, do whatever you need to do. And yes, we are going to offer that to our agents. Just waiting here to see if anybody else has any other questions. No, okay, no. Let's go back over this again. You can quote the Medicare Advantage and PDP. There is an electronic scope of appointment feature that you can use right now, but no, the actual enrolling is not live with CSG yet. So, okay, good. That's a great question. Why would we do the electronic scope of appointment? Okay, you would do the electronic scope of appointment a lot of times. So when agents are marketing themselves, we all know you cannot talk about Medicare Advantage and PDP. Okay, you cannot approach clients on that. You can approach them on their Medicare supplements. Through a lot of meetings, though, a lot of agents are realizing it's not a need for Medicare supplement. We do need to talk about Medicare Advantage. The clients, what they're looking for, their financial situation, their health situation, whatever it may call for. Maybe you do realize it's not a good fit for the med sup. You do need to talk to this client about Medicare Advantage. That's then when you can take advantage of the electronic scope of appointment to get that over to them and tell them, hey, we're going to need to talk about HMO, PPO based products. I need to get you to sign the scope of appointment so I can continue working forward with you on that. That's why you would use the electronic scope of appointment. The Medicare Advantage quoting and PDP, I think, would more or less not be for you to work with the client on to show them face to face, but more for you. Okay, so let's look at this in a scenario. Alex is going to go work with Mrs. Jones here in Nebraska, right? I call her over the phone because I'm going to sell her. Maybe she lives an hour and a half away from me. Alex is on the very East Coast. I'm in Omaha, okay, of Nebraska. That's on the very East Coast of it. Maybe over in the panhandle of Nebraska on the West Coast is where the client's at. I was going to try to sell over the phone, working with the client, going through the Medicare supplements to come to realize, okay, you know what? No, she needs a Medicare Advantage. I need to find her an HMO PPO network based plan because that's what's actually going to fit her needs over the Medicare supplement. Mrs. Jones, I have an electronic scope of appointment here. I need to get this signed before I can talk to you about your HMO PPO based products. Will you please sign this and send it back? We get her electronic scope of appointment. She sends it to me. Now Alex can get in the car if he needs to and head over to the west side of Nebraska to talk to her about her Medicare Advantage PPO HMO based plan. But before I do that, obviously she's in a completely different zip code than the one that I'm used to working. I'm going to run a quote with her zip code to see what is even available in her area so I know if I am licensed, ready to sell before I even get over there and talk with her. That would be a scenario where you're going to utilize electronic scope of appointment right now. You're welcome. Yes, I've done this once or twice. Yes, you should be able to find the quoting tool. I believe Brian Welch is also over at CSG. That's who I'm actually used to working with the most. Like I said, I just met Taylor last week. She came in the office because we were going to be running this webinar today. Her and I have actually been working pretty closely since last Friday just to do this webinar. We probably will continue to work closely moving forward. But Brian Welch actually works with her in her office. He's the one that is setting up the tablet friendliness, if you will. So yes, if you go underneath your Apple Store or the Google Store, whatever phone version you're using right now, I believe it should be underneath IAMS quoting. If it's not there yet, it would be the full insurance agency marketing services quoting. That's where you're going to find the app. Now, before you do that, you need to make sure you're registered with me. I don't want to create any confusion there. So you do have to register for this. I have to do a little bit of homework, make sure you're actually contracted with us, everything's looking smooth. Once you are and have writing numbers, I then will approve this for you to use. This is a great time of year, folks, to be using this tool. This is where uh, this is obviously a heavy season. AEP, October 15th, December 7th is a heavy season for Medicare Advantage, but this is also where we take a very big spike in Medicare supplement sales. And the reason why, it's the people that do not want to be on these Medicare Advantages anymore. They don't want the HMO, they don't want the PPO. Mrs. Jones lives in Nebraska in the summer and goes down to Florida in the winter, right? She wants to make sure if she's here, down in Florida, or in between, and something happens, she's covered. Obviously, a Medicare Advantage would not be a good fit for her from a cost standpoint, if you will. The Medicare supplements can be a better fit for her. This is where Alex is going to go find all the Mr. and Mrs. Joneses out there to flip them from their Medicare Advantage over to their Med Sup. A tool like this is going to help you streamline your business to be more effective in your writing, right? Agents, we're all running, not me, because I'm obviously on the broker side, but if I was a full-time agent right now, we're all running, 11 to 14-hour days trying to write the business. This is only going to help you with making your time more efficient. Yep, hospital indemnity. Taylor, are you still there?
Sorry, I was on mute. Yes, I am still here.
All right, hit that hospital indemnity run quote for me real quick.
Okay.
Yeah. Now, we're not going to have Taylor go in complete depth with this. Alex can run this with you, running offline. Yep, that's exactly what I was going to ask you to do. Alex can run this with you offline because, again, Taylor's not an agent. She's a rep for the software program, okay? Now, I know how this works. Yes, we do have the hospital indemnities. I am always suggesting Medico. You'll probably never hear me really turn away from Medico due to the cost versus the benefits you get. This is where you can get in there and start customizing your hospital indemnity product for the Medicare Advantage. Again, you cannot actually enroll on this. You can go to the Carrier Resources tab and do it, but no, the actual e-app platform is not on this yet.
And then also, I don't know, Alex, how much you want to get into this, but they can also change the benefit amount. I think you did just mention. So that can always change the price as well if they want to add different benefit amounts.
Yep. So a lot of Medicare Advantage folks that they want an MA because Mrs. Jones, she lives in Nebraska. She's never leaving Nebraska, but she has a little bit of money to spend, but doesn't want a Med Sup. This one, she takes a hospital indemnity product. What's a hospital indemnity product? It's a Medicare supplement to a Medicare Advantage, if you will. This is where you can get on there and really tailor her hospital indemnity plan for her from a cost standpoint. Okay? So again, you can quote it, you can run it, can't write it. This is what Connect for Medicare will also be there. I also have the apps. You can go to the Carrier Resources tab and I'm enroll underneath Medico, Heartland, all of these. If it's there, you can get on there and find it underneath their brochure. And that you can also pull brochures. I want to make sure I mention that with everybody. When you do get in the Carrier Resources tab, that Carrier Resources tab is essentially taking you to the sales portal for all these carriers. Underneath those portals, you can download PDFs yourself if you'd like. So again, as if you're an agent that's doing all online or trying to do more online and more over the phone, this is all going to be very beneficial to you. All right, I think the questions are starting to slow down. Okay, moving forward, like I said, thank you, Taylor, very much for coming on board, helping us. Please feel free to call me, email me, whatever you need to do. Otherwise, I am going to follow up with you at some point in time here. I go on a list from top to bottom. So if you want to get a hold of me before that, call me, email me. We'll get you set up on this tool, make sure the contracting's in line. Yes, this time of year is a really good time to be using this tool. We ran a webinar before on this. This webinar had a good turnout as well. So make sure you get a hold of me and take advantage of this because we are offering this free of charge. Okay. Well, Taylor, thank you very much. If we have any other questions that I can't answer, I will get a hold of you.
Sounds good. Thank you so much, Alex, and thanks for everyone for joining the call today. Have a great day.
Have a good day, Taylor. And Alex, that will pretty much wrap up our webinar. I will stick around here to answer any last minute questions that you may have. Let me know what I can do to help you.